So we had a multidisciplinary group of researchers from around the world to look at current coverage levels of radiotherapy in low, middle income and upper income countries. And we looked at current levels against what they ought to be given the disease burden. And we're very surprised with the findings. While there are huge deficiencies in low income countries and even middle income countries such as Brazil and China, where the coverage levels are 50% of what they ought to be, in sub-Saharan Africa, there are many countries with no radiotherapy facilities at all. But even in upper-income countries such as Western Europe, there's only one country, the Netherlands, that has reached full coverage levels.
That's a bit disturbing. What are the consequences?
Well, people are dying needlessly, of course. Radiotherapy is highly effective. It provides local control as well as improved survival for the individuals treated. And many of the, almost 50% of cancers can be addressed by radiotherapy. And what we set out to do was to demonstrate, A, that scaling up radiotherapy is feasible and possible, and B, that there are health and economic benefits. I think the unique feature of this study is that it's truly global. We looked at all countries in the world, and we looked over a period 2015 to 2035. So we looked at coverage level in each country, then we costed what it would take to scale up over a period of 20 years. So by 2035, full coverage was achieved. So we computed the costs. And then we looked at what we modeled what the health benefits would be. And we were able to identify that the health benefits would be 26.9 million life years saved as a result of scaling up. Absolutely, and that's a critical finding of the study, that beyond the health benefits that are of course very important, as individuals live longer and as they become productive, they generate economic activity and benefits. And the economic benefits outweigh the costs in low and middle income countries, including upper middle income countries. And the numbers are very large. While it would cost $84 billion to scale up over 20 years in low and middle income countries, the benefits are far larger. In fact, in the upper middle income countries, for each dollar invested, we get $6 in return. There's a compelling case for investing in radiotherapy. It's effective, it's safe, it's feasible to scale up, it brings health benefits, but it also brings economic benefits to the countries, as well as the social benefits from the suffering and the pain that can be alleviated in people who have terminal cancer. So one should make a case to decision makers, particularly not just ministers of health, but to ministers of finance, to the parliamentarians, and mobilize civil society and those affected by cancer to ensure that investments are made for the new technologies that are currently available. Absolutely, and that's a myth. Absolutely. We are able to demonstrate through case studies that even in very low resource settings, one is able to scale up high quality radiotherapy services. So the scale up is feasible, possible, it can be done consistently, and it can provide highly effective and quality care. There are no trade-offs. I think any cancer control program must include 4 components. 1, radiotherapy. 2, surgery. 3, clinical oncology with therapeutic medicine interventions, underpinned by strong health systems. And the moment is right, because universal health coverage aimed at strengthening health systems is one of the goals of the Sustainable Development Goals. So this is the time to act.